Good evening, friends. Welcome to the PANSIGHT webinar. Okay, today the topic is wrong diagnosis part 2. It's a vast topic. I could speak on this topic for easily some 20 to 30 hours. So what I'm going to do is, first, I will try to refresh your memory about what we discussed last week. Last week I showed 9 slides. So let us quickly review those 9 slides. And some of you didn't join last time, so it'll be helpful for them. I intend to share 50 years of experiential knowledge gained from practicing medicine in India, United Kingdom, and USA. My dear friends, 50 years is not a short period. And I had the opportunity to take care of patients in India, in United Kingdom, and USA. Maybe 100,000 or 200,000 patients. I cannot give the exact number. So I had the opportunity to learn a lot from making mistakes and from observing the mistakes made by others. So you'll be benefited from this experiential knowledge. And I can guarantee you one thing. You are really lucky that you are here today. This talk will help you a lot in the coming days. My webinar is always based on FAQ, facts, experience, and quotations. First, the diagnosis of diagnosis, definition of diagnosis. The art or act of identifying a disease from its signs and its symptoms. Word is recognizing a disease. But what is happening these days? Many doctors, they don't recognize the diagnosis disease. They treat the symptoms. They simply treat the symptoms, that is roga lakshanam. Do you agree? If you agree, put A in the chat box. Some of you may be aware of the fact. They don't bother to find out the diagnosis. Headache, yeah, they give a pain pill for the headache. A fever, yeah, they give a pill for the fever. Why? What is the cause for that fever? What is the cause behind that headache? No, they don't do that one. So it is something like putting a band-aid. Is it clear? If it is clear, put C in the chat box. It's simply putting a band-aid. It is something like a band-aid underneath that one. Whatever it may become ulcer. You are covering it with a band-aid. But you are not taking care of the underlying disease. Every year, more than 7 million incorrect diagnoses made in US emergency rooms. It is based on authentic government reports. In USA, it is happening. The population is around 33 crores. What about India? The population is nearly 150 crores. Definitely, at least 5 to 10 times more. So that is where everyone needs to know what you can do. What you can do from saving yourself from a wrong diagnosis. You can do many things. Diagnostic errors linked to nearly 800,000 deaths or case of permanent disability in US each year. And last week I mentioned that is, I was able to save my mother long time back because I'm a doctor. Not only a doctor, I am really good at thinking. Otherwise, in 1977, when she had a small lump in the breast, the professor of surgery, he said that this breast cancer, we have to remove the whole breast. Remove the whole breast. Then I got a second opinion. And from that second opinion, subsequently, that person said that, no, I'm not convinced. Did further workup, test, and eventually turned out to be a not cancer, a benign swelling. So she didn't have to undergo that radical mastectomy. Look at that one, the whole damage. I was losing one breast. The image, inferiority feelings, the pain, emotional trauma, saved. Wrong diagnosis. I was able to save my mother, but I was not able to save my father. When I was in India, when he was in a hospital, when he developed diarrhea, and they didn't bother to find out the cause of the diarrhea, and they didn't bother to find the cause of the diarrhea, and they gave just dextrose solution, intravenous. They didn't put salt, dextrose saline. What happened? I was in America. His sodium level went down, and he fell. He became drowsy. Drowsy means you tap, they wake up. Bystander, my mother. She thought that he was sleeping because of the surgery and all those. He is tired, sleeping. And he was discharged when he was drowsy. And he went home. And I used to call. I called my mom, asked him, how is he doing? And she told me, yeah, he's sleeping. Okay. Next day also he's sleeping. Then I thought, this is not right. Something is wrong. Then I asked one of my friends, who is a doctor, who is in Trivandrum, to go and see him. Because these days, doctors don't make any home visit. Just my friend, so he went home. And he suspected some electrolyte imbalance. Further workup showed low sodium. And he was in hyponatremia, low sodium for more than 3 days. He was given the sodium correction, permanent damage. By then, they had made it permanent damage. He became a totally different person. He lost complete interest in all his activities. He used to watch the video, he used to watch the TV news, he used to read the newspaper. No. And he lived for another 5.5 years. Totally different person. Why? Because of the incorrect diagnosis or not diagnosing properly and not getting the right treatment. So that is when I got really, and especially that is a real problem, genuine problem. There are many books on misdiagnosis, that is wrong diagnosis. What your doctor wants you to know, but doesn't have time to tell you. In USA, we usually get at least minimum 15 minutes when we see a patient, minimum. Most of the time, 30 minutes. And they are saying that you don't get the time. What about in India last week, when I asked the participants, tell me, how much time the doctor spends with you? Most of them responded, 3 to 5 minutes. 3 to 5 minutes. In 15 minutes again, they are not able to. 3 to 5 minutes. The doctors, they don't find the time to explain. And they don't even tell the patient, oh, hey, don't take this medicine on empty stomach. And patients, some patients, they take the medicine on empty stomach, then they develop vomiting because inflammation of the stomach, gastritis. Then you have to take care of the gastritis. That's a new problem caused by failure of the doctor to warn the patient. Do you agree, Dr. Hari Prasad? If you agree, put A in the chat box. Dr. Hari Prasad is a medical doctor, and Dr. Santosh also. If you agree, put A in the chat box so that others also will know. So there are other doctors also who agree with what I'm sharing with you. Dr. Santosh, I don't know what happened to Dr. Santosh. I don't see him. Okay, agree. Thank you. Three types of misdiagnosis. One, incorrect diagnosis, wrong treatment. That's what happened. That is what would have happened in 1977. Breast cancer, wrong diagnosis. Then she would have undergone the total removal of the breast. Incorrect diagnosis. Then incorrect treatment. Failure to diagnose, failure to treat. That is where my father, they didn't diagnose correctly. And they didn't treat him the right way. The third one, delayed diagnosis and delayed treatment. So my father's condition again, delayed. After 3 days, the diagnosis, low sodium. Delayed treatment. Useless. 8 reasons began: misdiagnosis, miscommunication, inexperienced young doctors. They are likely to make more mistakes. Be careful when you go to a junior doctor for a serious health problem. Incompetence. In India right now, there are hundreds of private medical colleges. Situation has gone from bad to worse. And there, most of the medical hospitals, the medical colleges, they don't have adequate staff, understaffed. In some departments, there's a head and then a tail. There's no neck, there's no body. Am I right, Santosh? Dr. Santosh, if I'm right, put R in the chat box. Dr. Santosh, he had the opportunity to know more about what is happening in India. So understaffed, yes, understaffed. Then you cannot expect the students to get good training. So they'll be incompetent. And many private hospitals, they take money, 50 lakhs to 1 crore. So they make the examiners also, pressurize the examiners to give more pass percentage. Just like what is happening in India, in Kerala, SSLC, 99% children they pass. Those who cannot even write their name without spelling error. So many people, they get MBBS degree. They don't know anything. They don't know anything. And your life is at risk. And especially those who are coming from China, Ukraine, all those medical colleges outside. They don't know because they cannot speak Chinese language. Then how can you get a good history and diagnose? So they have only bookish knowledge. Incompetence and high workload. Obviously, here a doctor. I worked in the government sector, federal government. I rarely used to see more than 15 patients in 7 hours. 15 patients in 7 hours. But in reality, I talked to one of the ENT surgeons in Trivandrum, who is a very, very busy practitioner. And he sees nearly 40 patients in 4 hours. That means each hour he sees roughly 10 patients. I used to see only 2 patients. Workload more. In the government sector, forget about it. Taluk Hospital and Primary Health Center. In 4 hours, they might have to see some 200 patients. High workload. Impatience. Yeah, doctors are also human beings. And you must understand. One after the other, they will be impatient. So they will try to clear the patient load. Greed, another factor. Because of greed, these days, many hospitals, many doctors, they order unnecessary investigations because they will get the kickback. CT scan, up to 50% they get back. MRI scan, up to 50%. Lab test, 20%. That's the incentive for ordering unnecessary investigations. And unnecessary investigations, the results, the radiologists will say, yeah, their CT is abnormal. This is abnormal. And that is abnormal. Then they treat the abnormality lab result oriented, not the actual disease. If I go, right now I don't have any symptoms. If I go and get an EKG or ECG, it will show, is likely to show some abnormality. Oh, then, okay, angiogram. Angiogram, again, I'm 70 plus. That shows some blockage here and there. Or then the cardiologist, if he's a greedy person, he'll say, yeah, what is stent? Let's put a stent or angioplasty to be on the safe side. That's what is happening. What about during the COVID time? What happened? COVID time, the angioplasty, stenting, everything came down. So nobody died because they didn't get stenting or angioplasty. So that itself is the proof that most of these investigations are unnecessary. Most of these procedures are unnecessary. Are you convinced? If you are convinced, put a C in the chat box. If you are convinced, this is a fact I'm sharing. Okay, thank you, Roy Chiranji. And so COVID really exposed the truth, that is, most of the investigations, most of the procedures are just to make money. That's all. So we must thank Corona Devi. Then misinterpretation of results, then fragmentation of care. What I mean is, yeah, 40 or 50 years back, if you ask a person, okay, who is your doctor, he'll say one name. Now, if you ask who is your doctor, he'll give 5 names. I have a neurologist, and I have a gastroenterologist, I have a cardiologist, I have an ENT specialist. Am I right? If I'm right, put right in the R in the chat box. When too many people are taking care of the patient, what will happen? They are not going to see the whole patient. They are seeing you only your ear. The other person will see only your chest. Then they will give medication. This guy gives the same medicine. The very same drug will be given by another person. Then drug overdose. That is happening in reality, my dear friends. Reality. So my advice, take home messages. Don't go and see a specialist. Go and see a general medicine doctor with an MD qualification. And if possible, make sure that that person is at least above the age of 30 or 35 or 40. And if that person says, okay, he thinks that, okay, you need to see a specialist, then he may refer. Then again, if you don't go to a multi-specialty hospital to see a general medicine doctor, then he will invariably, because revenue generating. That is business model. You see a doctor who is not part of a big hospital, multi-specialty hospital. I know that if somebody from the corporate sector hospital, they watch my video, they'll be angry. They'll be mad at me. Yes, I know that. But I think that this one is mission. My commitment is to the patients, not to hospitals who make money. I'm doing what is right. I'm pleasing my own conscience. Listen to your patient. He is telling you the diagnosis. Dr. William Osler, father of modern medicine. This is where many doctors, they don't have the time to listen, my dear friends. They don't have the time to listen. And these days, after the computerization, electronic, they don't even give eye contact. They will be sitting and typing data into this one. Am I right? If I'm right, put R in the chat box. Right. Okay. Thank you. And because the patients, when they communicate, they use the body language. Body language is the doctor should listen to the body language also. Watch the body language. Chest pain. If a patient says that I'm having chest pain, and if he is throwing the chest pain like this, the doctor doesn't watch that one, he may miss that one. If it is somewhere here rubbing, it is not from the heart. If he says I'm having chest pain here, it is not from the heart. The doctor misses. When the doctor misses that one, he'll order for ECG, he'll order for treadmill test, he'll order for angiogram. I never. Here also electronic medical records. For the first 1 minute, I would turn, revolving chair. Yes. Do you have any new symptoms? Do you want to say anything? When he says, I listen to him. I watch his body language. I watch his body language. And while I am typing in, again, I turn my head frequently to see what gesture they are showing. If a patient says that I have chest pain, and if he put a fist, then yes, the doctor should take it seriously. Yes. Fist. People miss that one. One of the first things we teach medical students, this is Dr. Velayanu Ramendran. He is originally from Tamil Nadu. He has authored many books. He is a famous doctor here. One of the first things we teach medical students is to listen to the patient and get a good medical history. 90% of the time, you can arrive at accurate diagnosis by paying close attention to history. Use physical examination and investigations to confirm your hunch. Got it? This is what I learned from my teachers. I'm lucky. When I was doing MBBS, I had the opportunity to work with doctors who are good at taking history. Dr. Hari Prasad, he may know, and Dr. Santosh also may know. Dr. K.N. Pai, he retired as the professor and head of the Department of Medicine. He was the first doctor who was awarded the Padma Shri. Very good listener. He takes good history. One of my problems, health problems, is a bit chronic. And I saw some 3 or 4 doctors. They gave me medicine, and they didn't. The medicine didn't cure. Then eventually I went to Dr. Pai and I narrated the history. And he asked some specific questions, specific targeted questions. And I shared that information. Then he prescribed a medicine, completely cured. Completely cured. Nobody else made that diagnosis. I was given treatment for amoebiasis when I didn't have amoebiasis and other problems. It was not infection. So, listening. So from that I learned I'm a good listener. And here also, I don't know whether we have Sriumaran Nairji here. I don't see him, but we have Dr. Ravindranath. He is an engineering college professor, retired, and he knows that I listened to his symptom and I recommended some treatment after listening carefully, and he didn't have to see any specialist. He didn't have to go to a hospital. He didn't have to even get a test done. His symptom cured completely. And just last week, the Sriumaran Nairji again contacted me. And again, no test, nothing. I prescribed him a medicine just for 5 days. It must have cost him only 20 rupees. Completely gone. Otherwise, if you had gone to see a specialist, okay, CT scan, all the other investigations, it would have cost him easily some 4,000 or 5,000 rupees and unnecessary medication. I'm very proud. And after practicing here for more than nearly 30 years, not even one case of malpractice against me. Usually within 5 years, 20% of the general medicine doctors, they get a malpractice case, lawsuit. In 10 years, 40%. Not even one. Because I always used to get a good history. Diagnosis on the basis of history. No unnecessary investigations, no unnecessary medications, no unnecessary antibiotics. The art of clinical diagnosis lies in the ability to ask the right questions. That also these days, young doctors, they don't know how to ask the right questions. Right questions. I told you I'm lucky. I had the opportunity to work with Dr. Matthew Roy, Dr. K.P. Chandrasekhar, Dr. P.P. Joseph. Very good clinicians. And I was very observant. And Dr. B.K. Harindran Nair, dermatologist. So I learned the art of asking the right questions. Before visiting a doctor or hospital, write a one-page summary bullet pointing your symptoms and medical history. This gives busy doctors more time to think about a diagnosis rather than gathering information. I repeat this one. This one should go inside your mind. Before visiting a doctor or hospital, write a one-page summary bullet pointing your symptoms and medical history. This gives busy doctors, especially 3 to 5 minutes, the doctor is going to spend with you, to think about a diagnosis rather than gathering information. When you present that one, now the doctor knows, okay, what kind of symptoms you have. Then he may ask the pointed question to get clarification. Is this crystal clear? If it is crystal clear, put CC in the chat box. I want to make sure this is one thing that will save you, my dear friend. Otherwise, some people say, hey, doctor, what can we do about the doctors? What can you have done, told us how to save. This is how to save yourself. Do the homework and present your symptoms. It won't take more than, make sure that it's present within 1.5 minutes. And when you see the doctor in the assume, then just read out or hand over if your handwriting is legible. Then the doctor will quickly get the idea. Then the whole diagnosis already, 50% diagnosis made. This is the only thing that can save you, my dear friends. This is the only thing. I'm sure that you might never heard this one from anybody else. Have you heard this from anybody else? If you have not heard it from anybody else, put N in the chat box. I want to know whether you are hearing it for the first time. Put N in the chat box. N, Lada Manojji. N. Okay, thank you. Thank you. Very crucial. Otherwise, doctors, they don't even listen. He asked me to stop. He didn't allow me to explain. Yeah, the doctor doesn't have the luxury. He doesn't have all the time. So he will cut you off. He will cut you off. You see that I'm very emotional right now. Because I've seen plenty of patients. They don't give a good history. I'm going to share some interesting experience also later. Current diagnosis depends on 4 things. History of symptoms. So history. Then history of existing and past illness. You have to tell them if you have got diabetes. The doctor cannot. Oh, looking at you, you have got diabetes. Oh, you have hypertension. You have the high cholesterol. No. Tell them history of your current health problems. Then comes the third history. What is the third history? History of allergy to drugs and foods. Doctor cannot know whether you are allergic to penicillin, you are allergic to sulfur, whether you are allergic to this food. Some people are allergic to mangoes. Some people are allergic to the prawns. Allergy. You have to tell them. Otherwise, he may prescribe a medicine. You are already allergic to that one. Yes, that may kill you. Thousands of patients that die because of the adverse effects of medicines. Allergic reaction. And history of past treatments and current treatments. If you had a stenting done, unless you tell the patient, the doctor cannot. Yeah, you had a stenting, angioplasty. Yeah, I can see that one. Oh, you are taking this medicine? Yeah, cholesterol medicine, statin. Yeah, I know. Mind reading? No. Everything within that 1.5 minutes. Present that one. Example of good history of symptoms from patient. I'm giving you one example. You're having fever with 3 days. Write down or tell the doctor, I'm having fever for 3 days. And I'm having some burning pain when I pass urine. That's also 3 days. And I'm having headache, 2 days. Vomiting and nausea, 1 day. These 4 points, how much time does it take? It won't take more than some 25 to 30 seconds. To say that I'm having fever for 3 days and I'm having burning when I pass urine, 3 days, and headache, 2 days, and nausea and vomiting, 1 day. How much time? Less than 20 seconds. But what is happening? Because I know I'm going to speak in Malayalam because when I was working in the medical college, OP, some patients used to care. Then I changed the whole approach. As in, എന്താ അസുഖം? സുഖമില്ല. എന്താ അസുഖം? Answer is സുഖമില്ല. എന്താണ് സുഖമില്ലാത്തത്? എന്താണ് അസുഖം? എന്താണ് സുഖമില്ലാത്തത്? ഒരു പനി. പനി തുടങ്ങിയിട്ട് എത്ര ദിവസമായി? കുറച്ച് ദിവസമായി. കുറച്ച് ദിവസം പറഞ്ഞാൽ എത്ര ദിവസമായി? അത് കുറെ നാളായി. ദിവസത്തിന്റെ സിനോനിമാണ് കുറെ നാള് കേട്ടോ. കുറെ നാളായി. എത്ര നാളായി? 3 നാളോ 5 ദിവസം അങ്ങനെ പറഞ്ഞു അവസാനം ഒരു 5 ദിവസമായി. പനിയല്ലാതെ വേറെ വല്ല അസുഖം ഉണ്ടോ? പനി അല്ലാതെ തലവേദന കേട്ടോ. ഒരു 2 എത്ര ദിവസമായി? കുറച്ച് നാളായി. എത്ര ദിവസമായി? 2 ദിവസമായി. ഇനി തലവേദനയും പനിയും അല്ലാതെ വേറെ വല്ലതും ഉണ്ടോ? വേറെ ആലോചിക്കാണ്. വേറെ BCOP, I have to see 40 to 50 patients in the next 3 hours. പിന്നെന്താണ്? അത് ഇന്നലെ വൈകിട്ട് ഛർദിച്ചു കേട്ടാ. ഓക്കെ. പിന്നെ പിന്നെന്താണ്? ഓർക്കാനുണ്ട്. To get this history, a doctor has to spend more than 1 or 2 minutes. Do you think that the doctor has the patience and the time to do that one? Then what happens? എന്താ അസുഖം? സുഖമല്ല. എന്താണ് പനി? ഓക്കെ, അവിടെ കയറി കിടന്നേ. Then he may prescribe a medicine for pani, fever. And he wouldn't diagnose urinary infection, that burning pain. And this person is already vomiting and nausea, orkanam. And he may prescribe a pill that may irritate the stomach. Already he has nausea, that will aggravate the vomiting. So you'll go home and you'll have more vomiting and you'll get to the hospital and get admitted. This is a real life scenario. Are you convinced? Because I am not exaggerating. Then I got tired. Getting a good history is very difficult. Then I used to ask, instead of giving the opportunity, എന്താണ് അസുഖം? ഒരു സുഖമില്ല. എന്താ സുഖമില്ല? ഒരു പനി. അതിന് പകരം ഇന്നിപ്പോഴെന്നെ കാണാമെന്നത് എന്ത് അസുഖത്തിനാണ്? സുഖമില്ല എന്ന് പറയണ്ട. എന്ത് അസുഖത്തിനാണ്? പനി. ശരി, പനി തുടങ്ങിയിട്ട് 2 ദിവസമായോ 5 ദിവസമായോ 10 ദിവസമായോ? അപ്പോൾ പറയും 2 ദിവസം. പനിയുടെ കൂടെ വേറെ ഏതെങ്കിലും രോഗലക്ഷണം ഉണ്ടോ? തലവേദനയോ ഓർക്കാനോ ഛർദലോ? പിന്നെ പറയും ഛർദലുണ്ട്. So I used to ask the right questions to get the right information. But not every doctor does that one. I am a person who has learned the importance of communication skill. That is exactly what here also in USA also, patients are poor historians. എന്ത് മരുന്ന് കഴിച്ചു? ഞാൻ 2 ദിവസമായിട്ട് മരുന്ന് കഴിച്ചു എന്നുണ്ടായിരുന്നു. എന്ത് മരുന്ന്? ഒരു വെള്ള ഗുളിക. വെള്ള ഗുളിക. പിന്നെ എനിക്ക് കണ്ടുപിടിക്കാൻ പറ്റില്ല വെള്ള ഗുളിക. അല്ലെ പിന്നെ ഒരു മഞ്ഞ ഗുളിക. Useless information. And I may be prescribing the very same വെള്ള ഗുളിക ആയിരിക്കും വേറെ ബ്രാൻഡ് നെയിമിൽ ഞാൻ എഴുതാൻ പോകുന്നു. I may be prescribing the same medicine because I don't know what he is taking, what you are taking. Are you now aware? Have I made you aware of the importance of giving a good history? If you have made you aware, say yes in the chat box. This is what you don't hear from anybody else. Anybody else, Dr. Ramendra, thank you. Anybody. This is the first time I'm sure that you are hearing useful and practical. Instead of blaming the doctor, oh, doctor didn't let me. ഞാൻ പറഞ്ഞുകൊണ്ടിരുന്നപ്പോൾ തന്നെ ഡോക്ടറോട് തന്നെ എന്നെ വേറെ ഇതിലോട്ട് പോയി. He didn't allow me to complete. Complete എന്താണ് story. He has got all the free time. Story. വേറെ ചോദിച്ചു എന്താ അസുഖം? അതെ, എന്റെ ശേഷാറൻ കേട്ടാ, എന്റെ ശേഷാറെ അവൻ പേർഷ്യയിലാണ്. എന്താണ് അസുഖം? അല്ലല്ല ഞാൻ പറയാം. ആ പേർഷ്യയിൽ നിന്ന് അവൻ ഈ ഓണത്തിന് വന്നതാണ്. ഓണത്തിന് വന്നിട്ട് ഈ ടാക്സിയിൽ പ്ലഷർ കാറിൽ വീട്ടിൽ വന്നു കേട്ടാ. എന്നിട്ട് അവൻ എന്താ അസുഖം ഞാൻ പറയാമെന്നുണ്ട്. എന്നിട്ട് അവൻ വന്ന് ബെല്ലടിച്ചോടെ തന്നെ ഞാൻ അവിടെ അടുക്കളയിൽ ജോലിയായിരുന്നു. അപ്പം ഞാൻ ഇങ്ങനെ ഓടി വന്നപ്പോൾ കാല് തെറ്റി താഴെ വീണു. അപ്പൊ ഈ ശേഷാറൻ ഗൾഫ് ടാക്സി ഓടി വന്ന് വീണു. അത് തുടങ്ങേണ്ട എവിടെയായിരുന്നു? ഞാൻ 2 ദിവസം മുമ്പ് വീട്ടിൽ വീണു. Right? Do you get my point? Do you get my point? If you get my point, put yes in the chat box. I'm really this video I'm using all these people who watch my video, they must understand that most of the time your diagnosis is wrong because of you are not giving a good history. Don't simply blame the doctors. I will say doctors also, but more than the doctors, patients are responsible for. They are not helping the doctor. Okay, thank you, Tajiji. So these are all real examples I'm sharing. You may think I'm sarcastic. Yes, I'm sarcastic. Health profile data, MAM, medical history. If you have got diabetes, hypertension, yes, make sure that is you. First, opening itself, you say, എനിക്ക് diabetes ഉണ്ട്, hypertension ഉണ്ട്, ഞാൻ 2 ദിവസം അല്ലെങ്കിൽ high blood pressure മരുന്ന് കഴിക്കുന്നുണ്ട്. Then comes allergy history. Tell them. Then medication history. ഞാൻ ഇൻസുലിൻ എടുത്തുകൊണ്ടിരിക്കുകയാണ്. Tell them the dose. രാവിലെ 30 units, വൈകുന്നേരം യൂണിറ്റ്. എന്നിട്ട് metoprolol blood pressure അതിന്റെ ഡോസ് അത് 20 milligram, 25 milligram, 50 milligram dose frequency. Doctors are our partners and they need all the assistance we can give them to be sure we get the right diagnosis. Always bring the following documents: past medical records. If you are in a hospital, if you have seen some doctor before, obviously you will be having some discharge summary. Bring that discharge summary, my dear friends, to the doctor. Bring that one. Prescription list, so that you won't be saying vella guliya, manya guliya, chonna guliya. Color coding. Here I made it. Here when I was working, I always used to tell the patients, put all your medications inside a brown bag. Bring it every time you come to see me. And I instructed my nurses to go through the medications and just put a list in the type. So when I go to see a patient, already I have the information about the medications that person is taking. And here plenty of patients, they take over-the-counter medication. That is no prescription. They may be taking ibuprofen for some knee pain. Or they may take some herbal stuff, food supplements. They may be taking garlic pearls. Many things from the health food store. It is a billion-dollar business, multi-billion-dollar business. And those, they interfere with other medications. Unless I know that what this person is taking, I won't know. I may prescribe something that won't work, or that may make this symptom worse. Consistently, I used to again tell the nurses, hey, tomorrow, go through the list of patients who are scheduled for tomorrow, call them and remind them to bring their medications. After 2 or 3 times, it became their habit. So every time when they used to come and see me, yes, they will have that brown bag. That is the way. A correct diagnosis, 3/4 the remedy. Dr. Mohandas K. Gandhi. Okay, even Dr. Mohandas K. Gandhi, the father of the nation, he was a naturopath. Did you know that? He was actually encouraging naturopathy. He used to give enema for himself every day, and he used to give enema for others also. And he delivered his 3rd son, I think, the delivery. He delivered. Again, he also gave a valid. That is a valid. I don't agree with most of his things, Dr. Mohandas K. Gandhi. But this one, yes. Correct diagnosis. The importance of a correct diagnosis, 3/4 the remedy. Warning, patient will be charged extra for annoying the doctor with any self-diagnosis gotten off the internet. Yeah, these days. They do the consult Dr. Google and they make their own diagnosis. And they come to see the doctor to get a second opinion. They already have their own opinion. They have made a diagnosis. So they have become already doctors. They didn't go to medical college. Just within 5 minutes, by Google says, they have made a diagnosis. So the doctors who spend 5.5 years for MBBS, 3 years, MD, they're all stupid. Okay? All it requires is 5 minutes and you have made a diagnosis. And some people, they go there already doing all the investigations also. From DDRC, Metro, they do that investigation. And when they see investigations, if you do 20 tests, sodium, potassium, magnesium, calcium, enzymes, at least some 5 or 6 will be outside the normal range. You don't have to worry, but you worry because you are not a medical doctor. So you don't know, okay, what is this? Oh, enzyme is 35, now this is 40. Oh, you worry. Then you do the Google check. What is the test again? Abnormal high reading. That is a liver, maybe cirrhosis. And the cirrhosis can lead to this one. Oh, now you are worried. Oh, okay. Then you go to the doctor with a diagnosis, I am having cirrhosis. That is how you irritate. You annoy the doctors when you go there with your own self-diagnosis and don't give a good history. My friends who are in Trivandrum, including Dr. Shaji, I'm sure Dr. Shaji will agree. Am I right? If I'm right, there is people do self-diagnosis. Yes. Dr. Santosh also. Self-diagnosis. And another friend, he is in Trivandrum, he is running a private hospital. I'm not going to mention his name because without his consent, it won't be right. He told me, ഞാൻ മടുത്തു വരിയാണ് ഓരോരുത്തരും അതിലും എസ്പെഷ്യലി ഈ ടെക്നോ പാർക്കിലുള്ള പയ്യന്മാരാണ് അവൻ അവിടെ എല്ലാം ചെന്ന് ഒരു 10,000-3,000 രൂപ എല്ലാം സ്പെൻഡ് ചെയ്ത് റിസൾട്ടായിട്ട് വരും അബ്നോർമാലിറ്റി എൻ്റെ അടുത്ത് വരുന്നത് അബ്നോർമൽ ലാബ് റിസൾട്ടിനാണ് അല്ല അവന് അസുഖമൊന്നുമില്ല ഈ ഡസന്റ് ഹാവ് എനി ഹെൽത്ത് പ്രോബ്ലം ഈ നൗ ഹി ഹാസ് ഗോട്ട് എ ഡയഗ്നോസിസ് ബേസ്ഡ് ഓൺ ദി അബ്നോർമൽ ലാബ് റിസൾട്ട് അപ്പോഴെന്താ ഞാൻ എങ്ങനെ ആദ്യം എനിക്ക് ഇറിറ്റേഷൻ ആയിരുന്നു ഇപ്പൊ ആയാലും ഒന്നുമില്ലെങ്കിലും ഒരു 300 രൂപ എനിക്ക് കൺസൾട്ടേഷൻ കിട്ടും കുഴപ്പമില്ല ആ ലാബ് റിസൾട്ട് മാത്രം നോക്കിയാൽ മതിയല്ലോ all I have to do is to look at the lab result. I get 300 rupees consultation fee. So that is the point. These days, people, they irritate, annoy doctors through their self-diagnosis. Shut your eyes to the medical columns of newspapers and you will save yourself many forebodings. Do you know the meaning of the word forebodings and symptoms? Foreboding, if you don't know, put N in the chat box. Foreboding. Then I will explain what foreboding means. No. Okay, thank you. And no. Foreboding means anxiety and fear. Yesterday also I was reading online some of the popular newspapers in India. Long COVID and the symptoms. നിങ്ങൾക്ക് ലോങ് കോവിഡ് ആയോ ഒറിയായോ ആ സിംറ്റംസ് വായിച്ചു കഴിഞ്ഞാൽ കോവിഡ് വരാത്തതിനും ആ സിംറ്റം കാണും കേട്ടോ when I read that word, I went through that list of symptoms. Even if you never had COVID, you will diagnose that I have having long COVID. My dear friends, stop reading all this bullshit. And this WhatsApp also. Oh, forwarding, sharing, this one, that one. That is creating unnecessary anxiety, phobia, and worries. That's what that quotation also. That is, shut your eyes to the medical columns of the newspapers and you will save yourself many forebodings and symptoms. Prescription without correct diagnosis is malpractice. That is what many people are doing now. Upcoming talks. Next Thursday, dangers of communication failure. After that, dangers of mind reading. I'm stopping this now because we will have 10 minutes where Dr. Santosh, he will share an interesting experience. He worked in a hospital as a medical superintendent, where because of the patient didn't give a good history, how the patient underwent unnecessary CT scan and other tests. And Dr. Santosh, when he went in the evening to the casualty, clear the patients in the observation, He could have got a good history and he saved the patient. Dr. Santosh, would you like to share that experience, please? Please turn on your video also. Let us see
video
you.
is not working. Can you hear me?
Yeah, go ahead.
This happened, of course, I was working as a medical superintendent, so I used
Volume
to
is low. Volume is low. Please
I used to
speak loudly.
I used to go for rounds in the afternoon and evening, morning, like that. So one day I just went and I found one young lady. Young lady means, of course, 30, 35, she is there. So I asked the nurse, what is that? She has some giddiness. Whose patient is this? So she said, it's a gynecologist. I said, gynecologist. What happened? So then she told me that she was referred to neurophysician. So I went and asked them, so what's your problem? She said, I'm having giddiness. So you went to gynecologist? Why? I got a little bit of pain. Okay, fine. What happened to the further? I was referred to a neurophysician. So what neurophysician? He examined and he ordered for an MRI. So MRI was taken. And I think they were waiting for the results or something like that. But how do you feel? Oh, I'm horrible. But from her eyes, from her face, she seems a bit pale. Young lady. So I asked the lab, our nurse, to get the reports. So till then, nobody collected the reports. They went around and collected the reports. And there I found that her blood count, WBC count, is pretty high. And her hemoglobin is low. So I said, do you have any fever? Oh, nothing. I got a little bit of pain. So I said, anyhow, check this. Her hemoglobin has come down. Her count is high. So I asked the lab people, hey, have you seen the slide? Slide? No. I said, come on, if you haven't seen, at least let me see, because the pathologist is not there. He may be coming late. But I went and I found some kind of odd cells. I said, yeah, these cells are not the typical WBC. It's some change. But because we test the blood using the machine couldn't distinguish between, immature RBCs and immature WBCs. White blood corpuscles and red blood corpuscles. That's where the count has come as bigger. Unfortunately, her. So I asked how many kids she got. I got 3 children. Only 1 kid. Okay, what about your parents? Parents. She didn't. I said, just check her whether the gynecologist has ordered for, pregnancy test. So the gynecologist, being a busy person, she is so busy. So she saw her, I think probably she examined and sent her to neurophysician. Bypassing, just use a fragmentation of care. She was sent to neurophysician. Neurophysician, he concentrated basically on neurosymptoms because of her giddiness. So nobody asked in detail about it. So after 5 minutes, the nurse brought me the report and I found she's pregnant. Hey, what is this? She's having pain. She has giddiness. She has blood, loss. That's where she is having. Then you immediately rang up the gynecologist and told her, Madam, she is pregnant. This is the thing. She is pregnant. Then she came immediately. Then I told her, look, this is the thing. Her count is also higher, but I can't make out whether it's immature or what, because pathology is not there. Hemoglobin has come down. She's pregnant. So immediately she did ultrasound abdomen and found that she's having an ectopy, rupture ectopies. I think she was having pain for 3 days. Then after the diagnosis, I asked the lady, when it is diagnosed, I told her, this is the thing, gynecologist come. Have you using any family planning? She said nothing. Only one periods. Oh, periods are regular, sometimes irregular, like that. So I think had the gynecologist had taken at least 2-3 minutes and asked her in detail, probably she would not have sent her. And this much of delay. She came in the morning. I went for the rounds in the evening, 3 o'clock. Then, of course, they said, and then in the meantime, the patient was referred somewhere. It happened. I don't know what happened. I think she was, operated upon. But it became a little bit of the relations became quite irritated and all those things like that. So one of the incidents which happened.
Okay, thank you. Thank you, Dr. Santosh.
Okay.
Let me just make you understand what happened there. A woman went and saw the gynecologist. And she told the gynecologist she was having giddiness. So gynecologist immediately referred the patient to a neurologist. Neurologist ordered the MRI scan. And some blood work test was also ordered earlier. And the MRI scan was negative. And by evening, when Dr. Santosh went to do the rounds, and he looked at the lab result, and it showed high count. The white cell count was high. Hemoglobin was low. And he examined the blood smear microscope, showed abnormal cell. Then he asked more history, and he came to know the patient was having abdominal pain for the past 2 or 3 days. The patient did not tell the gynecologist about the abdominal pain or history. And the gynecologist also didn't ask about your periods. And she had missed the periods. So he ordered the pregnancy test, which was positive. So she was pregnant, abdominal pain. And he told the gynecologist, she ordered then ultrasound. Ultrasound showed ectopic pregnancy. That is, the pregnancy was not inside the uterus. It was outside the uterus. So that one ruptured, became a medical emergency. And the patient was subsequently referred to a bigger hospital. Do you understand? The patient, who is blamed to be blamed? I will blame the patient, number one. You are going to see a gynecologist and you don't talk about abdominal pain, you talk about vertigo giddiness to a gynecologist. Is it clear? Is it clear that is in need and necessity to give a good history? The patients that day, because Dr. Santosh went and saw, he was able to save that patient. Otherwise, that ruptured that one, hemoglobin, more bleeding, internal bleeding or outside bleeding, the patient might have died. Do you understand the seriousness? If you understand the seriousness, put yes in the chat box. Because I have taken a lot of efforts to convince you the need. So tomorrow, whether you go to a VC, a doctor, or you take your father or mother or somebody else, your children, write down that one-page history, one page. Spend time. The doctor is going to spend only 4 or 5 minutes. Once you give this one, it should be readable also. Don't scribble. Just like what some doctors write a prescription, illegible. The doctor won't bother to. Write down. So that the doctor will be able to focus that on. Okay, if that patient went to the gynecologist and so that I'm having abdominal pain 3 days. I'm not having periods the last 3 months. Then the gynecologist should have focused on that one. Do you understand? If you understand, put you in the chat box. If the patient had given a good history, abdominal pain, okay, Dr. Leda, 3 days, I missed the periods for 3 days, 3 months. Yes. He would not have gone to a neurologist. He would not have got an MRI scan. And should not have been sitting in the casualty for 8 hours. Patience. So take a message. Don't tell me something, Dr. Reddiar, talking in the wrong. What can we do? The doctors are so greedy and doctors are very busy. They don't listen to us. What can we do? As if you are helpless. No, you are You are making yourself helpless. You can do certain things. Do that one. Yes, some doctors are greedy. Yes, it's a fact. I use the word some doctors are greedy. Not all doctors. But you must do what you can do. In Malayalam, there's a saying, Tan Padi, Devam Padi. Have you heard that expression? If you have heard that expression, put yes in the chat box. Tan Padi, Devam Padi. That is 50% my role, my responsibility. 50% God's. The same way, Rogi Padi, Doctor Padi. That is my own paraphrase, that one. 50% patient, Rogi. 50% doctor. So if you give a good history, yes, that will help. If you don't give a good history, that's what happened with that woman. She failed to give a good history. I told you right from the beginning that Velanur Ramachandran, history, good history, 90% of the accuracy of the diagnosis based on good history. So now I'm going to stop the recording. Before that, did you find this session really useful? This is the 1 hour you spend in your life, the whole lifetime. Do you think that this is the best 1 hour you have spent? If you that is what it is, mention that one. Yes, Rajan. You will never hear this sort of a talk from anybody else, that I can say with all confidence. And watch this video recording also at least a couple of times. Share it with your friends and other people so that your loved ones, you can save them. If they are too busy eating some popcorn, too busy going to the mall, too busy doing something else, yes, then they are responsible. Busy, bullshit. What kind of busyness? Busy doing nothing, busy wasting their time. And they say that they are busy. 1 hour investment, you can save your life thousands of rupees. I'm going to stop the recording. We'll continue the discussion. Anyway, thank you for joining this session.